But when you look back at it, when you're looking at building something, it has to be something that comes from within. It needs to be something that sparks a fire within you. You wake up every day and you envision yourself, I want to be able to be recognized as someone who did this.
Yes.
Even if you fail, at least you tried. I always say it's always good to do the hard things.
Yes.
If you never try, you'll never do it, and someone else will come. There's no new idea under the sun.
Hello, welcome back to Chapter Champions podcast. Today we're joined by Daisy, and we just had Daisy's co-founder in the last episode, Ike. So you had all those cool stories, and now you get to meet Daisy, and she's going to be telling us about her journey through life and tech entrepreneurship. And something that's really cool is I worked with Daisy my last 2 startups, and I call her my superstar colleague because she was a superstar throughout. And now we have this market force mafia kind of developing. Guys went out and they're building their own startups, and Daisy is one of them, and she's doing amazing. So we look forward to hearing a story. Daisy, outside building a really big startup in the health tech space, operational across multiple markets. She's also had a career in modeling. I think you're like, you'll tell us about it, but Miss Planet, finalist at Miss Universe, Kenya. So you'll tell us about that as well. Maybe you should start there.
I like how you're deviating that first. I'm always excited to really talk about my journey, how it all aligned, and some of the decisions I made growing up that initially, when I told people about what I'm intending to do, it wasn't a very comfortable space for them.
Yeah.
But now that I actually lived in that moment, they appreciate what it has shaped or made me become today. So first of all, joining into pageant, we all know if you're from an African background, your parents will never, ever support you. And it's because, not just supporting, it's because of the beliefs. Or, when we talk about pageantry, it's all about, beautiful women, but what's more about, being a beautiful woman or girl on the, the runway. I mean, you need to have a mission or a goal. So my goal was to actually stand for different advocacies, because I look back and I'm like, oh, when you look at the people with the crown, they have something they're advocating. I remember when I was very young, I was watching Miss World, the auditions, and there was this Cecilia, and she was advocating for jiggers. So I was like, this is a very good platform to talk about things, to advocate for things that you believe in. And for me, it wasn't, in my head, it never clicked that you have to be physically beautiful in that manner. Like, you just need to have something to advocate for. And, I always say, most probably everyone who gets a crown, they're never the most beautiful women. Because if the pageant industry was all about crowning the
most beautiful,
most imperfect, the one with no blemish, I think it would be different. But you need to really be unique and stand out. And most of these organizations give you a platform to advocate for different things. So I really, went for it. I was like, I might not be the tallest, I might not know how to catwalk, but it's something fun. I mean, I want to really advocate for being confidently beautiful, being, advocating for different things that you want to see, and also empowering women. It's one of the platforms that really highlights women's issues, staff and strengths, and also beauty with brains. So it's not just that. So the package, the beauty with brains, was amazing. And
What did you advocate for?
So I advocated for multiple things and with the different platforms. One of my goal was I would never run for a platform that doesn't have something behind it.
Yeah.
Okay.
So when I went for Miss World Kenya, it was advocating for beauty with a purpose. And my purpose was to empower young girls and women. Miss Universe Kenya, empowering women to be confidently beautiful. And I remember at that time, if Tesh you remember, I was really battling acne. It was just crazy because you'd walk around. I would walk around in the streets in Nairobi and I would get people staring at me because my face was like really had big pimples and breakouts. And I'm like, you know what? If I focus on it, people look at me like, this is just Daisy walking down the street. So I changed it. I played the mind game issue. I was like, okay, so what draws people closer? It's all about smiles, how, authentic or open you are.
Yeah.
So there's a time I used to walk in the streets with all my blemish, no makeup, nothing. I'm like, when I walk down, if anyone
Looks
tries
at
to
you,
stare at me,
you
I smile back.
Yeah.
And what reciprocated was they smiled back at me. So if you look back on my social media, I call myself DaisySmiles. That's how DaisySmiles 100 really kicked off.
Okay.
So for me, it's all about just being charismatic, being your true self and being optimistic about life. So when I went for Miss Tourism, I remember my goal then was to really advocate and champion for different advocacies around tourism, particularly promoting cultural practices, the promoting some of the things that bring the beauty of a country. And this was very strategic, Tesh, because I remember then we were working on Cloud9 XP, a lot of experiences, and I was like, this is a perfect way to market for the different things. We would go to Diani, you're like, oh, these beautiful white sandy beaches. You'd travel down to, Whistling Moran, you're busy down on go-karts, the Masai Mara, and it's like, this is very beautiful. So if I line or I join this organization, I can actually expose things that people don't typically see.
That was very strategic.
Very strategic, very extremely strategic. And then came Miss Planet Kenya. And Miss Planet Kenya was all about the SDG goals, so Sustainable Development Goals. And it was at the right moment because I was looking at aligning. That's when Zuri Health was just kicking off.
I see.
In my head, I'm like, this is really empowering because I'm working at in a product that would essentially transform the way we access healthcare, and it is very impactful. So when you dig, I don't know if I tell my story right now, we won't end this, but throughout my life, it has been very, very strategic. And I really like to challenge or tackle challenges heads on. So I always say I have this fear of failure. If you ever attempt to tell me, Daisy, you cannot do it.
Yes.
I will break barriers to
That's
show
your
you that I can really
That's
do
your
it.
fuel.
So that's what fueled my, change. I remember when I was really bright for a reason. I was very bright. I grew up a tomboy. I used to be the games captain, playing football and running. So I was never the perfect, lady like to do pageant. So when you're tempted or just try to tell me you cannot do this, I'm like, it's easy,
I'll
I'll show you I can do it. And it took me to places, and I really look back and appreciate that. I'm able to empower women so they can know this can actually be done. And even in terms of my professional level, when I did my maths and computer science, it was just to challenge the norms. Because I look back and I'm like, everyone wants to do medicine. Everyone wants to be a lawyer and to do this. But when you look at the demography, most women are not taking these courses.
They don't do computer science.
Yes.
I remember joining the first year, I joined the class and you were like 10 or 11 girls out of a full class of 100. So we had
100%.
that, and we had that, mission, like we really need to show the guys that women also have brains, that we can actually do it. So when I look back, I'm very, very appreciative. All these stories have really aligned to shape to the lady I am right now. And it didn't need me to conform to the societal laws that you're a girl, you need to do this, that, and that course. I had to challenge some of the norms. In fact, in my head, I used to there's a reason why there are different age groups or gaps. There's a reason why we had our parents in their era, the millennials, the Gen Z's vibe, and it's all aligning perfectly. So when they lived in the industrial era, we also lived in the digital era. We witnessed both the analog and the transition to digital. And then we have the Gen Zs who probably don't understand what analog is.
True.
And it's a very perfect blend. So I'm really excited. So this is, where I am and who Daisy is.
Wow, actually, that's like very well put. And on this subject of like challenging the norms, was now joining a startup very early on one of those things you sought out to do as a challenge, as opposed to just going through a traditional career?
I don't think so. In my head, when I grew up, I knew I like to do something. I never liked being led. Like I never liked to work under someone. I really struggle because in my head I'm like, I really need to be something. I need to build something and empower people. But I think the opportunities that came in place was because, first of all, I remember I graduated with maths and computer science, and I talked to Tesh and Mesongo at that time. I was like, I really need an internship opportunity because I also didn't understand how to place myself. So I think the opportunity to really work with young entrepreneurs who are building something really opened my mind into what we're able to solve. And even it grew, it built up the love I had for technology.
I see.
I always call myself, I'm a soft life babe. I know most people don't want to talk about the soft life thing. But when I talk about soft life, is not about just living the easy life, but utilizing the tools that you have to make your life efficient or easier. So if I want to travel right now, how efficiently can I book my flight? How can I get my accommodation? How can I, do things seamlessly? If it's sending money, receiving money, so those kind of things. And it opened opportunities to really identify some of the problems in the communities. If it's towards accessing healthcare, what can I do with my skills or knowledge acquired through, entrepreneurship or computer science to leverage that to build something that will solve a problem? So that's how, eventually I found myself into entrepreneurship. And as Atesh mentioned, I've never worked in a very big corporate. I've always worked in a startup, and he was my one and only boss. Exactly. Yeah, like you're my super boss. Like you showed me the ways how to tackle challenges. It was never a rosy experience. Because you see that those days in a founder's life where there's the highs, and everything is like, the season is like, oh, it's a winning season. And then there's the season where reality checks in and you're like, what do you do? Do you wake up and quit? Do you just go and say, just give me a job, I'm done handling all these work pressures? So,
or even no salaries.
Or even no salary. Exactly. And you're like, but when you look back at it, when you're looking at building something, it has to be something that comes from within. It needs to be something that sparks a fire within you. You wake up every day and you envision yourself, I want to be able to be recognized as someone who did this.
Yes.
Even if you fail, at least you tried. I always say, it's always good to do the hard things.
Yes.
If you never try, you'll never do it, and someone else will come. There's no new idea under the sun. Everyone is already thinking about, how can I do that? How can I integrate GPT and AI? So it's all about, how do you execute better?
Yes.
And when you're passionate about something, even if you face those, challenges, it always appears like a smooth cruise, because at the end of the day, you know what the rewards are. And it also shapes you as a person. So I was very excited, pursuing entrepreneurship, migrating into different channels that people assume like, oh, you can not be able to do it.
Yeah.
I remember when I fully transitioned to Zuri Health, I was locked down in Eldoret. It was during COVID. And we were still on cloud 9 experiences. And I was at that point where you're really thinking about, what do you do with your life? Do you quit?
Yeah.
People are now missing out on jobs. Are you now looking at building something new for yourself? How you looking for opportunities? So that moment was very, I always say, like, for me, COVID-19 was a blessing in disguise.
I see.
For a reason. The reason why I got to really, I think it was the longest time I spent with my family back at home. I think it was a period of 4 months. It used to be, it was a polite weekend visit. And then
ended up being
a 4 months.
Really? Oh, that's how it started.
Exactly.
You were just going to visit for a short time.
For a short time, yeah, because I stay in Nairobi and my parents live in Eldoret. So I had to just go and pass by, say hi. During that time is when they decided no moving around. And here I am.
Yeah.
Yeah. So just being in that moment, also envisioning how my parents work, going into to work every day, which also aligns to why I decided to, build Zuri Health and build Zuri Health with my heart. Yeah. So
wow, interesting. So you're very grateful to COVID.
I'm very
for
grateful.
it really birthed
Yeah.
Zuri Health. So like
Mhm.
just curious about Zuri Health. So from Cloud9 to Zuri, and usually before something is really born and like it comes to be and it starts moving, there's like a conception that happens in the mind of an idea or something. So like how did you get to that? Like how did you sort of like come up with that process of like let's start or try something in healthcare?
So this is what happened. I will take it back to part of the reason is I really like to challenge the norms. So my parents have a background in medicine and engineering.
Okay.
And for the longest time, they were like, Daisy, you're a very bright girl.
Mm.
Why don't you do a course in medicine?
Okay.
Yeah.
And for me, it was, to be a doctor, it's a calling. I like to see people happy. And sometimes, working in an environment, sometimes you'll see a lot of people suffering.
Yeah.
It can take a toll
Take a toll on you.
And my mom lived in denial even after I graduated.
Okay.
Because I remember he pushed me to do an internship in a hospital.
Okay.
Because in her mind, it was like, you're born to be a medical doctor,
Yeah.
So I did my three months internship in a hospital. But still, I mean, I didn't get that validation to work there. But I knew I had to do something. But not just that, because my love for tech, I used to manage a lot of tech products. I remember when we were still with Mesozi in Market Forest, we used to manage a lot of tech hubs. And one of them was Playdate.
Okay.
So Playdate, my co-founder, Ike, was building a dating app for Africans.
Okay. How did you get a chance before we even let's talk about that dating app. So how did that idea came about? Like people don't interact enough. It's difficult to find people. Let's solve this problem.
No, it's cool. I mean, at that age, like when I look back, things aligned perfectly with the right time.
Okay.
Daisy was a very young girl, bubbly, ready to, move into the dating scene full swing. I just graduated and, life was good. So the idea behind Playdate was how you're able to make connections, at least for Africans.
Okay.
Is like more than like a Tinder for African, but it had a smooth turn.
Okay.
So the fact that you had to incorporate the gifting method, the anonymity was really exciting.
Okay.
So
okay.
I was if you check my phone, I had downloaded all the dating apps.
Okay.
I was trying to do the mix and match, but it was really exciting just to meet people. And you never know where you meet. You can meet your billionaire or something.
Yeah, I know. You could meet on Instagram or it could be
Yes.
you can start anywhere. The spark.
Exactly. And I think I just started my relationship then. So I was excited about, just curious about this is something that no one has thought about it before. And for the first time, we're building something that can be easily absorbed by the African continent because of the cultural and practice in which how people get to meet. You know how you're a girl, if someone sends you flowers, it sounds more genuine. And it's not just, it's not just a flower on the cloud, it's an actual physical gifting. So that was like a really cool experience. And when I started managing the technical team building Playdate, I think I did it with, so much love. Because anything that involves tech, I put
Your
my
heart is in there.
Yeah, my heart is in there.
Yeah.
So during that time when we were building, so the lockdown happened. As I mentioned, I was in Nairobi, in Eldoret. And at that time, we were still managing the different products team from Nairobi. We used to have a lot of Zoom calls, Google Meet calls, virtual calls, and we would still work. And I would sit down and look at my mom, prepare to go to work in the hospital. And that time, everyone didn't know everything about what is COVID or how is the virus spreading. We just knew a lot of people who are dying from COVID are the elderly, they're the ones who are prone, and the infections mainly circulate from
individuals.
So it's like this is very painful for me to watch because I don't know. Sometimes my mom would come back to the house and be like, don't step into the living room.
Yes.
Just go clear and go to your rooms. There's that self-isolation even within the homes. So IK had started building Zuri Health before.
Okay.
And his goal was to build a basic mother and baby hospital because of personal issues. He almost lost his daughter at childbirth. And he promised himself one day when he gets some form of money, he will build, a basic mother and baby hospital.
Okay.
So here I was, diligently and immensely working on the Playdate dating app.
Yes.
Yeah.
And he was watching how I worked and how I managed the technical team.
Mm-hmm.
And I remember he had that conversation because he approached me and said, Daisy, can you look for someone who looks like you or works
Okay.
like you?
Okay.
And it didn't hit the bell. He was trying to poach me. And I
Oh,
think he had that
gosh.
conversation with Tesh.
Okay.
You ditched me, Daisy.
I did. It was that one painful call. I remember taking the call in the garden and explaining to Tesh, it's good to have challenge, And the reason why was because when I looked back, we were working on Cloud9. I was managing Playdead. But when you looked at Cloud9, during COVID, no one was traveling.
Yes.
So in terms of no one is booking flights, no one is doing experiences, everyone is on lockdown. So in my head, I was like, okay, this is a really good opportunity to build something that has an impact.
Yeah.
And besides, I had all the free time in the world. I mean,
Cloud9 was not busy at all at that
at
time.
all,
At that time, yeah.
So in my head, I was like, if we can actually connect leisure seekers to experience providers, we can still be able to, connect doctors to patients.
Yes.
So
boys to girls.
Boys to
Or boys to girls. Everything is a marketplace.
Exactly.
Yeah.
So when Ike mentioned the idea to me, I didn't even had to think about it twice. First of all, what went in my head was like, shoot, for the first time, my mom will understand what I did,
Yes.
what I've been, what my life has
She
been
could
in tech.
be proud. There's a small chance she'll be proud.
Exactly, because I know for like you look at her deep down, she's like, oh my God.
My
Out of all
daughter is
my
lost.
kids,
Yes.
no one wants to follow my path and be a doctor, So in my head, I was like, this is really, really cool. For the first time, my mom would be proud.
Yeah.
And I immersed myself. We started working on Zuri Health. So that's how, basically how Zuri Health started. And the goal was to just provide affordable, accessible healthcare. When we started building, I built it diligently. Like, this is my baby.
Yes.
I would be so proud. I told my mom, oh, this is an app we're launching. And you as a medical doctor, you can actually come on. She was the first doctor to onboard onto the app.
Oh, that's dope.
And I think she looks back right now and says, there's a reason why things align. If probably I went the course of, just being a medical doctor, maybe I would not understand the value of technology and innovation in healthcare space. But I look back, I'm
even
like,
creating the impact at
exactly.
scale that you guys are doing. Yeah.
So I look back and I'm like, I always say things fell in place at the right time. And when you look at opportunities, if you get not everyone gets this kind of opportunities. It's not the same time I'll be in the same table with Tesh, in the same table with Mark, but there's a reason why that timing is aligned in that moment. So I always say, even the reason why we really scaled fast as Zuri Health was because we launched at the right time.
The timing
we launched
was
at
perfect.
COVID-19, yes. So it exposed the underbelly of healthcare challenges. People were now keen on their healthcare. People now understood that, you can actually integrate, virtual care onto the systems. We need to have now policies to align whereby where can we integrate telemedicine, a component of it, decongest the hospitals, de-risk, transition of different viruses and per se. And even at-home lab tests, so not just, communication with a doctor, but also AI technology, virtual screening, tools, pharmacy medication delivery, tackling the distribution. Because when you talk about also healthcare, I will not say it's not like we don't sometimes have these resources. We do have them, but the distribution is a problem. All of them are in Nairobi. They fail to reach someone in Bomet, someone in Isiolo. But if you tackle the distribution as well, you're able to diversify the resources and also ensure that even someone in Turkana gets access to this medication, this healthcare system. And they're still able to have that opportunity to chat with a doctor. They don't need to travel all the way to the city to get, consultation or appointments with doctors.
That's really interesting. Like how you really were able to dig into your skills in computer science, your learnings, all the experience working together in startups and launch this thing. There's a big question I'd be asking myself listening to you, which is, during COVID, there's all this lockdown, there's no resources, you're not earning a salary per se, like it's minimal salary when we think about launching a startup.
Yeah.
You think you need resources, right? Like, how did you guys, and Ike mentioned also at that period, he'd lost all his revenue in the entertainment business. So this must have been a really, really tough time financially. So how are you able to gather up resources? What kind of resources, or how are you able to launch Zuri in the midst of all that crisis that was happening?
I look back, I know this sounds vague, but I always say it's the grace
The grace of God.
of God,
Yeah.
because we did not have the funds completely. And I remember when I was joining IK, I had to, I think for the first 3 months, work without salary.
Mm.
But the beauty about it was during lockdown again, I was conveniently staying with my mom.
Mm.
So I was at home, the pressure of, rent and these
Yeah.
things did not conform.
Mhm.
But it was important that we build something that has a clear path to profitability. How do you build a sustainable revenue business model? And we had to do a lot of research.
Mhm.
You download, you see who is your competitor, how long have they been operating, what's their revenue model like. And I remember when you talked about, if we needed to get commissions, the business would not be sustainable.
Okay.
Because if you're working on 10% commission, 5% commission, it won't sustain you beyond, paying salaries or running different operations.
Yeah.
So we had to diversify our revenue business and model streams. And that was a very tackling or tough time, because when you look at, this is now a new health tech startup emerging.
Yeah.
The background in the investor space is most health techs are for grants. Like they only
it's
rely
like a
on,
social
it's a
enterprise.
charity,
Yeah.
exactly. And for us, that was not it. We needed to work
You're
on,
building a business.
build a business that has a way to impact and empower people, to also be sustainable on its own. And the beauty about it was the team was very diverse. I remember IK with a background in SMS. Myself, I've always been on the techie aspect of it, more building apps and whatnot. But we have to really work with what's the core problem. So if the problem is your target audience cannot afford to pay for your products, how do you really minimize that portion but still provide something that is self-generating?
Yeah, it's actually quite difficult. Yeah.
Yeah. So when we first launched, our business was built to generate revenue from day one. And that was first working with the telcos, mobile operators who have grasped distribution, and the cost of acquisition was extremely low. So what we basically did was to change the way vast services is provided to provide healthcare. So when I talk about vast services, we see a lot of, when you talk about someone in the village, the key people who subscribe to betting, gigs, skis at tunes. And they are willing to pay like 10 shillings to just have that, gospel music playing in the background.
Yes.
And we needed to transform this to provide that, actual care. So we had to really study. When you look
so that the audience is following versus value added
the
services.
Yes.
Yeah.
Value added service. So when we look back, we needed to really tap for all the market. We really needed to do a lot of research on what is healthcare. First of all, it's a fundamental human right. So you cannot say you're only building for people in the urban cities. You need to find out, how are you also having an impact on the lower margins.
More inclusion.
Exactly. So that was one of the ways. So we started generating revenue from day one. And the beauty about it is working with the telcos.
So the telcos were your customer?
Telcos were our customers, but they already built Reels. So we were channeling that, the available subscriber base, and also doing a revenue share with them. Because when you look back at how it's evolving, telcos also want to provide more value to you. That's why it's a value-added service, other than just airtime billing and data billing. So they want to see how they can provide financial aspect through Fuliza. They can provide, data services. They can provide other value-added services. And what a better way for healthcare? Because when you look about healthcare, it's the most fragmented. It's where we have a lot of gaps.
Yeah.
The ones who only receive quality healthcare, the people who can afford healthcare, which should not be the case.
Yeah.
So we really scaled fast because of the telco connectivity, our SMS bit, and then the mobile app bit. Remember when I started, the goal was to just build a basic mother and baby hospital, similar to what any other health tech was doing. But they struggled, and we had to study this. Like, why have they been in business for 10 years? They've not broken even. What are their revenue business like? What is their customer acquisition strategy? And from these insights, we were able to see, first of all, they may be solving for people in the urban cities.
Okay.
If you ask me, do you have a problem going to the hospital? I'll be like, no, there are clinics within the estate. But if you tell the same thing to someone in another part of
The
Kenya
country,
or a corner, they'll be like, that's like, one of the things they really need to solve. They're always scared to even go to the hospital because they cannot afford it. Most people live below 100 shillings, $1 a day. if you tell someone, if someone wakes up today and they're fallen well, the first thing they will ask you is, have you eaten? Because the thought of you going to the hospital,
Yes.
you leave us bankrupt. You'd
Yeah.
rather live without knowing what we're
It's
suffering
true.
from.
It's true.
Yeah.
So we had to really study all these things. And it was very strategic. So I look back and I'm always saying all the experiences that we've encountered shaped us to where we are today. It was also a very low moment. I don't know if I can mention this, but it was the time that he also got diagnosed with diabetes. So during that time, he also got scared during COVID. I mean, it was affecting most of the chronic patients. And
in fact, a lot of people who
yes.
had diabetes were really affected.
yes. So he got scared. I'm like, oh my God, am I going to die? And all these things, like all those,
thoughts
fears
come to your
and
head.
thoughts. And his wife was a medical doctor, Dr. Bonner, just told him, you don't need to actually go to the hospital. We can have someone come pick up your sample. You can have your call with the doctor, your specialist doctor, and your results will be sent to you virtually. So through that experience, Ike asked himself, so you mean it's actually legal
It's possible.
and possible that without myself going to the lab to do my lab test,
sample,
I can it's actually, legal. So he called us and he was like, you know what we're building? We're still not solving what we intended to do. Because we need to provide a holistic healthcare system, an end-to-end patient journey. What happens after I connect you with a doctor? The doctor probably prescribes you some medication or asks you to run some tests. So do you need to now move out from your house, go all the way to do your lab test or get your medication delivered? No. So we had to plug in the labs services and the pharmacy services. Such that you're able to start and end your healthcare journey on the platform where you are in. Looking about also the mobile penetration, everyone has a mobile phone. So through SMS, through a WhatsApp chatbot, through the mobile apps, for us was to get you at your point of need. And that's how we started. So that's how we plugged in,
That's how we became a virtual hospital.
A virtual hospital, literally. And it was also, sometimes when you have something new or change, there's always like, people don't like change. They'll be like, why don't you just focus on being, if it's a pharmacy delivery, focus on being a pharmacy delivery. If it's lab tech. And we researched again. I mean, when you look back, you'll never survive. Most of the businesses, health tech businesses that are unimodal solutions don't survive much. Because first of all, when you look at, we're really good at customer acquisition. The customers you've acquired, how do you leverage to
keep on earning from this customer
exactly
for some time,
so the customer retention beat and also in terms of, because we're also operating in a space where it's highly regulated, so in our goal was to actually expand into multiple markets, but it was also one of the ways when we provide multiple services and solution, it's a way to de-risk our business.
Yes, that's true.
Interesting.
Wow.
You're one of the businesses that's really used like WhatsApp super well. Like you built a chatbot
Early on.
Very early on. Maybe you can walk us through why you thought that was important. And then also from the struggling days of 2020 and you figured out monetization, you guys have also raised quite some funding. You can also share how that went.
I think so. I think part of our growth and the strategies were formed by our actual users.
Okay.
And we were very, we would be very keen on providing the best universal health experience. So from the feedback survey, how would you like, your services? And when you talk about healthcare, is a little bit different from, other super apps like Instagram, TikTok, the social media apps. We would have clients call and say, hey, I want this service. And when you tell them, you can search our services on the website or go to Google App Store, Play Store, search, download. By the time you finish, you've lost the client. I just want, when it's health, it's an emergency. I just want this. Can I get this?
Then you have to tell them to go to the App Store.
Exactly. So when you look at also some of the, even on our social media, someone will just, go onto our DM and like, hi, I want this. That is a way of showing you how, how people consume different things has changed. So it was very, very important for us because we look at it, and if we've already, validated the business in terms of how people engage on SMS, what even a better way to churn it into a WhatsApp chatbot? And when you look at WhatsApp chatbot, most phones, at least most basic phones, can accommodate WhatsApp.
Yes.
Yeah.
So for a user, they don't need to download another app.
Yes.
It's
Yeah.
already an super app saturated market.
Yeah.
And when you talk about, how to provide more value added, on SMS, there's a limit because it's only text-based consultation.
Yes.
When you look at the chat, the WhatsApp chatbot, you can plug it across multiple communication channels onto our Instagram, social media, Facebook, onto our, Twitter, and so on. And not just that. When you look at how WhatsApp build it, for us, our goal is to leverage the existing digital tools. So what a better way, because through WhatsApp, you could now have not just text, but also audio visual consultations.
Yes.
Yeah.
You could share your imagery, files, PDF, so prescription, medication.
Nice.
You can track, you can make online payment with your card. And you're like, this is actually what we need. At first, when you tell someone something new, there's always like, can it be possible?
Yeah.
But it's always about changing the norms.
Yeah.
And not just now measuring your KPIs as number of app downloads.
Yeah.
Because you can have
Yeah.
1 million plus app downloads, and then you look at the
The
active
actual
users
usage,
or
yeah,
paying
yeah.
customers is
Yeah.
zero.
Yeah.
So we really needed to really grasp that. And we've seen a really high uptick.
Okay.
Right now, just someone was just, can I scan it? Can I just get the number? Call. And that for us is a value add, as long as they're able to get the service they need. And efficiently. So it's not a matter of gambling who has the best looking super smartphone.
Yes.
No one will care if you have the most fancy health app.
Yes.
But for health, because it's a need, it's not necessarily a
Just
want,
needs
it's
to
not
work.
luxury, it needs to work. And this is how we really, transition from all this
Wow.
building a multi-channel. Yeah.
Wow, I think that's brilliant. Just leveraging on the existing technology and like and the other thing we realized with WhatsApp, which I think it's quite amazing for health as well, is you find like, for example, in rural Kenya, someone has bundles for WhatsApp, but then they don't have bundles to search the internet.
Correct.
So it's just very inclusive. So I think just that's like an amazing job. I think as we go into the next one, and Tesh mentioned it. So Zuri is doing well, they're starting to scale, customers want what you're building. And with that comes sort of like catch-22 with building a startup. You can't grow fast enough because you need some sort of capital. You need to scale up operations, all these things. So how did you guys now transition into seeking funding and growing your team?
First of all, I was very, very green. I had never started like a startup. I was just a young founder. We never knew about what fundraising was all about.
Yeah.
But, it was very important because immediately when we launched, the first few weeks, not even months, the kind of traction and revenue we're generating was very significant. And they would see, an actual demand for the service. So from that, some of our key friends were like, why don't you open up something, because this is something that has a potential to scale. But for you to scale and to scale fast, you might need some engine oil, fuel, funds to help you scale beyond the borders, because if I have to like still, work there with, initially our goal was to just bootstrap to profitability.
Okay.
But what would be the easiest way if someone else has raised millions of dollars in funding to easily incorporate what you're doing and kick us out of business?
Yeah, that's true.
So we attracted a few of the angels.
Okay.
And from the few of the angels, we now, from accelerator programs, there was a need to really start, fundraising, but we never knew I had to research what is seed, what is pre-seed, what is this, what is safe, what in convertibles.
I know,
I mean, and I really needed what is the data room, as simple as what is the data room. So we learned in the process.
Okay.
And when we opened the round, I remember the first times it was so hard. You're getting no's.
Yeah.
Some investors even tell you or talk you about how you're going to fail, how they've been backing up other startups that do this way, but because you're doing the other way, you might crash.
Actually, maybe even highlight that more. I think many people don't know how many no's you get.
Yeah.
Like how many, do you remember like you talk to this many investors?
I do remember because I had a template whereby I had listed all the investor leads and, milestone, how far we are, maybe just sent an intro, what was the feedback. And it used to crash. Like you just feel like, okay. But what kept us going was we knew the business in terms of we are generating revenue, But one most important is also the kind of strategic partners that we also got
Mm.
from our angel investors, some of the people who are in our advisory board, empowering us with the skills and the connections. So we started applying for the different programs, accelerator programs. We were lucky enough to join. I can mention names, right?
Yeah.
Mhm.
Yeah.
Yeah, I remember the first investor to give us a VC check was Founders Factory Africa.
Mm.
And we were, I think we were jumping up in the office like, and it was that point where you're not sure, because I remember we were building, but part of the building came, sacrificing. Sometimes
Okay.
you have to pay the staff first
Yeah.
before you pay yourself.
Yeah.
And how do you navigate all these things? It bit by bit. But that fund, when it came, it really fueled our growth.
Yeah.
We had it was still in the first year.
Mm-hmm.
And the beauty about, getting the first VC check and their credibility, it opened up for follow-on funding from other investors.
Yes.
And I think also with the investors, they have this FOMO type, because some of the previous investors that were telling us no, are like, okay, this is,
Now
we want also a piece of the cake.
Yes.
You know?
When we get funding,
We get
they come back.
It was an exciting experience.
Mm.
It's always not rosy. So when I look back at the investors that came in on board for us to close our pre-seed round, they're just like a 0.0 something percent of the investors that we talk to.
Wow.
So you sometimes you need to talk to a lot of investors, and some might crush you. Some might, tell you how you're going to fail. Some will tell you wait.
How this idea has not worked in Asia.
In
or
Asia,
some
and it should
company
not
they
work.
know,
Yeah, how can you convince me that I will get my money back when you're only charging 10 shillings of SMS? So all these things. But for us, it was all about building with the key customers. Because someone else can tell you, and I always say it, I know I should not say it, but sometimes opinions from people who don't fund or run businesses, when you now tell them to enter into your shoe and build a business, they will never do it.
Yeah.
But because you're in that position, you'll have to make it work regardless. And you have to really work or collaborate with the different stakeholders, the players. If it's the one who's bringing in the funds, and also most important is your customer. Those are the ones who you're paying customers or clients.
Yes, the ones you should listen to.
You should listen to more. So for us, it's all about, building something for Africa by Africans, and also understanding the problem that we are solving for our society. I would not build a super app for someone who barely has a smartphone. It would not make sense. They don't. So you have to just build using tech to diversify and just ensure that you stay afloat.
Awesome.
Wow.
Yeah, I'll ask a question that Max likes a lot, which is, what did you advise a 24-year-old Daisy?
This is, oh my goodness. Why am I overthinking right now? So at 24, if I look back, I would advise myself to keep it going. Everything aligns. Follow what you believe in. Even if it's that slightest thing. If you believe, this wood can one day become, just believe it.
Yes.
There's a reason why when you believe in something, for some reason it's your destiny. You will always work towards that option. And just trusting that everything will align. It will never be rosy. And I think also with a lot of with more growth comes more responsibilities. So it's never an ending journey. It's always a learning process whereby you wake up today, you're in this level position, but you're always looking at, when will I be?
Yes.
When will you elevate? So it's like a staircase. So when you take step 1, you're now in step 2, there's always more steps ahead. And, we always just trust that we will always together, and not just alone, make the world a better place.
So that's awesome. Almost as a parting shot, but I want this to be the parting shot.
Okay.
Which is, now you're a boss. How do you think your colleagues would describe Daisy as a boss?
I don't even like to use the word boss.
Okay. Tell us.
How I would think they would describe me?
Yeah.
I think I'm very optimistic.
Even what you call yourself.
Yeah, I think I'm very optimistic, charismatic, go-getter.
Okay.
Yeah.
And
The
all
winner. The
And?
conqueror, the champion.
Lion.
No, I mean, you have to, let me tell you. So there's why I say these things. You have to believe it in your
Yeah,
brain.
it's true.
When I say it, sometimes we're like, why is she saying these things? But they play a very big part in terms of shaping who you are as
That's
a person
true.
or as an individual. So yeah, the lion, the
Yeah.
conqueror.
And you're a Leo like me. Yeah.
Yes.
I remember that too. So you're a lion for real.
Yeah.
Awesome. Thanks, Daisy. This has been fantastic.
I know.
Thank you.
So thank you so much for coming here today. I think for our audience, if you enjoyed this episode, be sure to subscribe. Follow us on at chapter.co on Instagram, chapter.co on Twitter, and chapter on YouTube. So thank you so much for coming, and we'll be following your journey.
Thank you, Mark. Please join us.
Awesome.
All right, cheers.
Cheers.